Today I'm going to talk about cellulitis. This is a very common infectious disease or infectious condition that people seek treatment for. So what exactly is it? So cellulitis is infection of the deeper layers of the skin. And often it occurs on extremities like the legs, and it is associated with redness, swelling, warmth, and pain. And what happens is that bacteria that usually live on your skin, like strep, find their way through cracks in your skin and set up an infection. Now, this infection can be quite painful and quite concerning, and oftentimes people seek medical care for it. But it is fairly simple to treat. It's usually going to be a course of antibiotics, maybe anti-inflammatory medications, and telling people to elevate that extremity to try and decrease some of the swelling that might be there. And that usually works for most people. A couple of things. It's usually going to be on one, for example, if it's on a leg, it's going to be on one leg, not both legs, because it's an infection. If it's on both legs, it might be something different. The other thing is, oftentimes people show up saying they want IV antibiotics for this, but there's nothing magical about IV antibiotics. If someone can swallow pills and they're not vomiting, most antibiotics are going to work comparably in cellulitis for both the IV and oral route. And certainly just coming into the emergency department to get one dose of IV antibiotics makes zero sense, although it's very common, but doesn't really change the outcome. So strep is the most common cause. MRSA, which we've talked about, can also cause it. Usually in that situation, there's more pus around it. It's not just an angry red leg or an arm. You can get cellulitis around your face, which can be treated much more aggressively because we don't want it to progress, especially if it's around the eye. Certain exposures, like in fresh water, can cause a really severe type of cellulitis caused by specific bacteria like Vibrio. So that's treated much more aggressively. And we watch cellulitis to see, does it progress over time? And don't expect it to get miraculously better in one day. It's probably going to take 2 or 3 days to start to see the redness and swelling recede. The other point about cellulitis is that it's something that is a common thing that people come to see people at the hospital for. But when it first starts, it may start out like as a boil or a pimple that then spreads. So you need to be aggressive early on with getting it treated before it spreads and becomes much more difficult to handle and interferes with your life.